resources in implementing EHRs, are the payment incentives for achieving meaningful use enough?
I think the incentive payments seem to be sufficient in terms of overcoming the major financial barrier. There have been over 200,000 registrations for the Health IT Incentive Program, and over 60,000 providers paid. Just in the month of February, we had 17,000 providers paid. So there's real movement towards moving forward on adoption and meaningful use of the health IT. So in that sense, it's had its intended effect. But we also recognize that there are non-financial barriers to providers moving ahead, particularly in terms of vendor selection, project management, actually getting through the process. And that's where the regional extension centers, who are now working with 40% of all primary care providers in the country, come in. And they've really, I think, helped for that segment make them be able to move ahead. I think we need really almost a 63rd regional extension center, which is available to all providers online, who can help understand those best practices and move forward on the non-financial barriers.
As more data becomes available, what challenges are you seeing for physicians to achieve meaningful use?
A lot of the challenges really are around IT project management, training, vendor selection, vendor readiness and support they get, particularly on the smaller practices. They are in very large part dependent on the vendor, helping them get through the process. So making that right decision in terms of what vendor you choose and how you work with the vendor most effectively is a really important decision for the small practices. In terms of providers really getting the most out of meaningful use, not just qualifying for meaningful use, but getting the most out of it, that's where I think the biggest opportunity and challenges here is for the providers, and I was speaking to the cardiologist here today, to really, it's up to them to work together to find ways of making the most meaningful use of these tools that we've provided in terms of the form of the technology and the meaningful use requirements. So the biggest barrier, I think, isn't going to be actually just qualifying for the program or getting the checking boxes. It's going to be, how do we do more than just check the boxes? How do we make use of that in the most effective way possible to improve quality, to improve safety, to improve care coordination and patient-centeredness?